Why 3-day crowns? Somebody asked me that the other day, and I said, well, why 2-week crowns? And they couldn't answer that either. You know, because it's kind of like, well, why? And the only reason why most of us have done 2-week crowns, I know I did, is because that's what my dad did. And that's what every lab did. And 40, 50, 60 years ago, dentists had lab technicians in their practice, and all they did was cast gold. And then the PFM came out like in 1960, and it was the rise of the commercial laboratory because dentists didn't know how to stack porcelain. It was too tough to do. And so commercial laboratories decided, we'll get it back to you in 2 weeks.
Yeah.
You know, it must have been one lab tech, like somewhere in Des Moines, Iowa, who said 2 weeks, and then everybody else decided to do it. But it's got no basis in reality. So when we were all at Glidewell together, I'm practicing inside the lab. It's about the best situation you can ever have. Cindy's my technician. And I'm still having to do occlusal adjustments on a lot of the crowns. And I'm thinking, what? How is this happening? It's not like it's being mailed to the other side of the country. These should be fitting. And I was having issues with it. And so I began to look at the temporary crowns, and I began to notice that my well-meaning assistant was polishing them so much that she was accidentally taking them out of occlusion by a couple hundred microns. And so to minimize the influence of the temporary, I asked Cindy, could we please try a project where we start doing the crowns in 3 days? So when she started bringing them back to me after 3 days, even if the temporary was accidentally out of occlusion or a contact might have been slightly open, it minimizes that influence by putting it on 3 days later. And what you notice is the adjustments that you do go down by about 90%. And when you look at adjusting crowns, you know, there's good ways to adjust lithium, disilicate, and zirconium, but we shouldn't be touching crowns. It doesn't do any good for the crown. Aesthetically, it makes them look right. The contours are bad afterwards. And even when you smooth them off, if you look with an SEM, you'll see a bunch of microfractures under the surface, and those connect over time during function, and that can lead the restorations to fail. So it's never in our best interest to adjust the crown. And the biggest way to avoid it is some people say, well, I'll adjust the opposing tooth. Well, sure, that's fine, but we don't want to adjust anything. And the patient's super impressed when that happens too. And if you follow Relic Christian's protocol of putting 2 coats of Gluma on the preparation before you put the temporary on, 3 days later when you take the temporary off, you can put air and water on the tooth and it's still desensitized, so you don't have to re-anesthetize the patient and get them numb again and put that crown on. So everything is smoother at the cementation appointment. There's far less adjustments, far less anesthesia, and crowns just drop into place when you do it. After 3 days, so I became sold while I was practicing inside the lab, but even then the lab wasn't ready to do it. And even now, I don't see labs that are ready to do it. You guys are like the only one I've talked to that have kind of followed this. And I've been talking about it in lectures for years, and labs get angry at me sometimes. They're like, we're gonna have to hire more people. We're gonna have to do this, we're gonna have to do this and this. And I'm like, look, I'm not happy about it either. I mean, I really don't care one way or the other. I'm just here to tell you, we're not doing the patients any benefit by putting this piece of plastic on their tooth for 2 weeks that leaks. We know it leaks, and it's got a failing temporary cement. It can shift around. They don't like having it in there. You tell somebody, don't floss, you have a temporary, and what does a man do? He flosses for the first time in 17 years and knocks the temporary off, and then doesn't come back to the office because he's coming back 7 days later anyway, and now the crown doesn't fit. So nothing good happens. So in an ideal world, I guess we'd all be doing same-day dentistry. We'd be prepping it and putting the crown on. But most dentists aren't willing to invest that kind of money and change the whole way they work and have their staff learn how to design and mill and standing glaze crowns. So if you're not going to commit to same-day dentistry, and I understand that most dentists still aren't, at least 80-85% of them aren't, and they like their labs, but you know, let's go to 3 days. 2 weeks is just wrong. And we know this is wrong because you ask any dentist, if a temporary crown's on for 4 weeks, 6 weeks, 8 weeks, 4 months, they know that the chances decrease of it fitting as time goes on. And I'm here to tell them the opposite's true. The quicker you can put a crown in the mouth, the better it's going to fit with the less adjustment. So there's no reason not to do it. And I'm really happy that you guys are the one laboratory that kind of sees this vision of dentistry as I see it. I believe that when all 3 of my kids are dentists, even though none of them have shown any inclination to want to go to dental school, but when all 3 of them are dentists, everyone will be doing crowns in 3 days. So congratulations on being the first to adopt that strategy.
That's amazing. Straight from Dr. DiTolla's mouth, and we just thank you for your time.
You're welcome. And I'll be talking about that and more at the Los Angeles Dental Meeting.
So stop by your booth, listen to Dr. DiTolla's seminar on zirconia, and we'll see you soon.
See you there, guys.
Bye.